Borderline personality disorder is a heavily stigmatized condition. In popular culture, the reality is shattered. Patients are routinely labeled as manipulative or impossibly difficult. That media caricature is completely false, and it does real damage to people living with the condition. When a medical condition is treated as a personality flaw, it creates a wall between the patient and the care they need. People are forced to suffer through intense emotional distress in silence. This chart shows the baseline prevalence of the condition in the general population. About 1.4% of U.S. adults meet the criteria for BPD. In clinical settings, that prevalence spikes. Walk into an outpatient mental health clinic, and that number jumps to 10%. At the most severe end of the clinical spectrum, BPD accounts for roughly 20% of all long-term psychiatric inpatients. Despite these high numbers, many patients are routed into the wrong care pipeline. They are frequently misdiagnosed with bipolar disorder or categorized as having treatment-resistant depression. Because the root condition remains unrecognized, these patients spend years cycling through medications and therapies that do not address their actual symptoms. This matrix outlines the clinical threshold for a BPD diagnosis. Clinicians look for a specific cluster of symptoms, requiring a patient to exhibit at least 5 out of these 9 distinct traits. The first cluster involves relationships and identity. This includes frantic efforts to avoid real or imagined abandonment, unstable interpersonal relationships, a disturbance in how they see their own identity, and chronic feelings of emptiness. The second cluster is emotional and cognitive. Patients experience intense emotional reactivity, mood shifts that last for hours rather than days, along with intense, inappropriate anger and transient stress-related paranoia or dissociation. The final traits are behavioral. This manifests as impulsivity in potentially self-damaging areas like reckless spending or substances, and recurrent suicidal behavior or self-harm. These 9 traits establish a specific recurring pattern. Clinicians recognize this cluster as a defined medical profile rather than a series of random outbursts. The diagnostic manual tells us what BPD looks like on paper, but it doesn't tell us why a human being develops it. For many patients, the condition emerges from a triad of early experiences: significant psychological trauma, profound emotional invalidation, and early attachment disruptions. Those 9 clinical criteria are survival adaptations. They are the mechanisms a person develops to cope with deep, unhealed psychological wounds. Once we recognize that trauma drives the behavior, the conversation changes. We stop judging the patient and start focusing on how to actually help them heal. Healing is possible. Despite the lingering myths, BPD is a highly treatable condition. The gold standard of care is dialectical behavior therapy, or DBT, developed by Dr. Marsha Linehan. DBT is a multi-layered approach. It combines individual therapy with dedicated group skills training, between-session phone coaching, and clinical consultation. The clinical data shows that DBT reduces self-harm, lowers emergency room visits, and decreases hospital admissions. Other evidence-based modalities like mentalization-based therapy, schema therapy, and transference-focused psychotherapy also offer robust pathways to recovery. The measurable success of these targeted therapies demonstrates that the stigma is unfounded. With the right clinical support, patients get better. People living with BPD are dealing with genuine pain, and they deserve specialized, evidence-based treatment. If you are looking for that specialized care in Georgia, coping and healing counseling bridges that gap. CHC provides a diverse, culturally competent team of over 15 licensed therapists, including clinicians specifically trained in dialectical behavior therapy. They offer 100% HIPAA-compliant telehealth services across all 159 Georgia counties. To make this care accessible, they accept major insurances, with sessions costing between $0 and $40, as well as Medicaid for a $0 copay. You don't have to navigate this alone.